Assalamu alaikum, brothers and sisters. Am I audible? First of all, I would like to thank you all for giving me this opportunity to being among you esteemed people. Thank you so much. And again, thank you so much. So now we will proceed with the impact of oral health on the general health. First of all, I hope you all are not too drowsy after the lovely, delicious lunch that we all had. Who all are suffering from food coma? So as you can see, starting से डेयर वाले जो है आप लोग बहुत अच्छे से you have ignited the oral as well as the general health connection by serving us lovely lunch. So now with that, let us proceed. As you all know, the mouth is the gate to the entire body. The mouth, as such, not only is it a gate, it provides a window to the entire body. So, any issue, at first you can just take a peek in this window and then you'll have an idea. For example, be it anemia, be it jaundice. Anemia, when you first see, you see the pallor in the mouth, right? Jaundice, you see a yellowish discoloration in the buccal mucosa as well as the lingual mucosa. So as you can see, the mouth as such, if properly read, it gives you clues as well as symptoms for the entire general health. Not only that, not only that, the mouth also houses hundreds and thousands of microorganisms. As such, the microorganisms, they are all commensals which live in a very mutually productive environment. You have your friendly neighborhood Candida albicans, which as such is a normal friendly commensal. But in case of opportunistic infections, they can definitely cause havoc. So what I'm trying to say is, it is very important to maintain the oral microflora because any other condition like certain medications, they can alter the oral microflora and then they can actually result in different conditions. So that is the reason through my lecture I'm trying to establish a connection between the oral as well as the general health, the impact that the oral health has on the entire body. The link between the oral and the physical well-being, it's not just symbolic, it is completely physical because whatever you eat, it goes through the mouth. So if you have any germs, any infection, any inflammation, any pus in the mouth, obviously it's going to go into the gut, it's going to go down into the system. So that is why it is very important to safeguard your oral health because that will definitely impact your general well-being. At the same time, the mouth, as I just mentioned, is the primary pathway. So anything that enters, that is going to be the first, one of the first barriers. Like after the skin, the mouth also guards the entire body. Normally, like I said, there are various oral microflora which live in a mutually conducive and a mutually beneficial atmosphere. However, certain diseases, for example, you have diabetes, these can actually definitely impact the oral health, which will definitely have an impact on the general health in indirect as well as direct ways. There are various studies which have established that not only the oral microflora has an impact on the various conditions such as heart, it also has a bearing on gynec, on various, it also has a connection with cerebrovascular accidents, etc. So there are certain diseases such as you have HIV, diabetes, etc., which will definitely impact the oral microflora. And not only that, the oral mucosal barrier is torn because of which that kind of impacts the entire general health. So, what are the conditions which are directly linked to the oral health? First and foremost, there is a direct relation between oral condition, oral microflora, and endomyocarditis. What is endocarditis? Anyone? That's the inflammation of the heart valves. Of course, the most dangerous one is going to be acute endocarditis, which is caused due to staph aureus. But definitely, due to the oral microflora, you can definitely have subacute endocarditis. The condition of the various conditions which will allow this to happen are recent prosthetic valves. A person who's had a recent prosthetic heart valve or a recent MI, these are going to be at higher risk for getting oral subacute endocarditis. The pathogen responsible here is going to be Streptococcus mutans and Streptococcus pyogenes, which are very common on the oral cavity, especially in the plaque. So any kind of dental procedure, it is very important that you first start off with a proper antibiotic therapy before going ahead and starting the dental procedure. The reason is there are certain dental procedures such as extraction, root canals, any procedure which is slightly invasive that can actually cause transient bacteremia wherein you'll have pathogens entering into the blood and directly they can go to the heart, and that can definitely result in subacute endocarditis, which is as such a life-threatening condition. Then there are several studies which suggest a direct relation between the oral health, the plaques in the mouth, and the atherosclerotic plaques, which are responsible for the cerebrovascular incidents such as stroke as well as even myocardial infarction. There are various studies which have suggested that periodontal inflammation as such, can trigger various conditions, and that can have a negative impact on the oral well-being, can have a negative impact on the general well-being of a person. The plaques in the mouth, they can negatively impact and result in myocardial infarction, stroke. There is a direct connection which has been found. Am I audible? Yeah. Pregnancy and its complications. As a woman, pregnancy, we know it completely alters the well-being of a lady. During pregnancy, there are certain hormones. During pregnancy, there are certain hormones such as progesterone as well as estrogen, which are as such food for the black pigmented anaerobes. That is the reason during pregnancy, a woman's dental health suffers. There are various conditions such as pregnancy gingivitis, pregnancy epulis, which can definitely occur during pregnancy. As a result of this can be triggering. There are various studies which have suggested that these periodontitis conditions, these have known to trigger premature myocardial infarctions resulting in preterm labor and no birth babies. There are studies going on, but definitely there is a distinct connection. I can see someone is yawning. Is it very boring? So let me proceed. Going on to pneumonia. Again, there's a direct link between the oral cavity as well as the lungs. There have been conditions wherein many people indirectly have swallowed. There's cases of aspiration pneumonia, lung abscess, which have been associated with an aspirated or infected tooth sometimes. Because anything that happens, pneumonia and all, there's supposed to be a connection between pneumonia, COPD, and various respiratory conditions, including lung abscess as well as the oral bacteria. Chronic health conditions, obviously, they not only do they impact the general health, they completely disturb the oral microflora, and there appears to be a shift. So there appears to be a symbiotic or a synergistic relation between the dental diseases as well as the general diseases. One such very good example is going to be your diabetes. Diabetes and oral health, diabetes and gingivitis, I would say, there is a vicious cycle here. Increased levels of your blood sugar levels, these will engorge the gingiva, resulting in gingival and periodontal diseases. At the same time, because of this, these increased oral infections will not allow the proper treatment of diabetes. So, in order to control your diabetes, you also have to address the oral issues. That is very important. Otherwise, you're just trapped in the vicious cycle. Another such example is HIV or AIDS, wherein the person's entire immune system is down. So, because of which all the opportunistic infections come into play, such as candidiasis, etc. Not only that, the first symptoms of HIV and AIDS is first apparent in the mouth in the form of non-healing ulcers, lesions, severe, extremely engorged gingiva, bleeding easily, all these are going to be early signs. They are the harbingers of HIV. So that is the reason, in order to treat first, in order to first, it is the duty of the dentist to first address these conditions, get the test done, and then confirm the HIV, because one of the first symptoms are going to be seen in the oral cavity first. Now going on to osteoporosis. Osteoporosis, again, it is a very common condition wherein the body loses bone. There is a lot of loss of calcium, and this is very common in elderly ladies and all. So again, despite there is a connection between osteoporosis, there is your dental health, especially your teeth. At the same time, the medications such as bisphosphonates, which are given for the treatment of osteoporosis, these can further undermine the quality of bone of the jaws. So as it is, the osteoporosis is going to be affecting. At the same time, you even have bisphosphonates, the treatment, the medication given for osteoporosis, which can also negatively impact the quality of your dental bone, the maxilla and the mandibular bone. At the same time, Alzheimer's disease, you might wonder, how does it impact the oral health? Obviously, as a person's mental health keeps deteriorating, they start losing their senses, and because of that, the oral hygiene, everything suffers. So eventually, what's going to happen is, leading due to bad oral and dental health, you're going to be having different infections. You're going to have gingivitis, periodontitis, which again will impact the general health of a person. Now, there is other conditions also which have been which have a direct correlation with the oral cavity. Especially, there are certain conditions. One of the most common condition which causes severe xerostomia is going to be a Sjogren's syndrome. Sjogren's syndrome is going to be an immune disorder which will definitely causes dryness of the mouth as well as the eyes. That is the time you can actually appreciate the importance of saliva. The saliva not only does it lubricate, it also has a protective function for the entire body. A condition such as Sjogren's syndrome can result in severe xerostomia, as well as it also causes dry eye. Xerostomia will eventually cause various different functional conditions such as mouth ulcers, again gingivitis, periodontitis, dental caries. All these can be associated with bad oral hygiene, which is due to extreme dryness of the mouth. There are various other conditions which can also be associated, such as you have, most importantly, your oral cancers. Cancers, again, they can be very apparently seen in the mouth, such as certain cancers such as leukemia. The earliest signs, the harbinger, is going to be severe extreme bleeding in the teeth. Especially, I've seen a case recently of acute ALL, which was seen in a very small kid, wherein he was having extreme bleeding gums and all. And finally, it so happened that the actual causative factor turned out to be leukemia, and the only clue initially was severe bleeding while brushing. Similarly, there can also be various other conditions, clotting disorders, then you have bleeding disorders, which can be first detected in the dental chair. There are certain medications again which can affect the oral health. There are certain medications such as you have your antihistamines, you have various painkillers, antidepressants, which can again result in dry xerostomia or dry mouth. This will impact the oral cavity and result in various conditions. One of the most common condition of severe dry mouth or xerostomia can be seen following your radiotherapy. In case of radiotherapy, what's going to happen is there's going to be severe xerostomia, which can actually result in a condition called as osteoradionecrosis, wherein the extreme xerostomia actually causes necrosis, osteoradionecrosis. So, like, I would like to conclude by saying that dental and medical should go hand in hand. There should be a synergistic relationship between the dental practitioners as well as the medical practitioners in order for the complete optimal health care of the patient. Because in the end, for us, most important is going to be the patient health. So it is very important that the dental and medical practitioners work hand in hand for the betterment of the patient in order to attain optimal as well as a good health of the patient. Thank you. Any doubts? Any questions? Assalamu alaikum. Initial stage, squamous cell carcinoma occur before no bleeding, but in the first stage, confused bleeding is yellow and yes, sir. Cases of hemophilia. Yes, sir. Voice is not clear, sir. Voice is not clear. Sorry. Then I want to know about bleeding signs in the squamous cell carcinoma of Canada. This is a delicious. But in the terminal stage and late stage, there is bleeding. So this can be gradual so oral maxillary. Another question is that in the hemophilic patient, hemophilia, blood bleeding from the nose and how to differentiate this? Thank you so much, sir, for the questions. That means you are actually listening. So my answer is for squamous cell carcinoma of the oral mucosa. Initially, the first sign is going to be a non-healing ulcer. It forms like that first. The first stage is going to be a non-healing ulcer. The patient is just going to be complaining that there is going to be an ulcer which is not at all responding. Eventually, as the stages progress, that is the time when there is going to be severe bleeding. So initially, it starts with a non-healing ulcer, not bleeding. Going on to hemophilia, there are various, not only hemophilia, I have seen cases where a simple extraction could lead to the diagnosis of that. When we extracted, there was continuous bleeding. That is when we could actually differentiate between the hemophilia and all. Otherwise, it is very difficult to differentiate unless you do the lab test, of course. Depending on the BT and CT, CBCT, that is how we actually differentiate. Was it very short? I kept it short and sweet.